So good morning everyone, my name is Ramil Christopher Didumaran from BSN1A and today I'm going to perform the assessment of the posterior thorax. So in this process or in this assessment, there are three processes that are involved. The inspection, palpation, as well as percussion. So before anything, to start off, we need to inspect our patient if there are presence of edema, as well as lesions, masses, or abnormalities. So we are now going to inspect our patient. So upon inspecting our patient, there are no presence of edema, as well as lesions, masses, as well as abnormalities. So the next thing that we are going to do is to do the general palpation of our patient, and it is to determine if there are any pain felt by our patient, tenderness, masses, lesions, as well as abnormalities. So before we start, we need to sanitize our hands. Sir, is it okay, sir, if I am going to palpate you, sir?
Yes, sir.
So now we are going to palpate our patient. So upon palpating our patient, it is felt that there are no hidden edema or as well as masses, lesions, and abnormalities, and there are no pain that is felt by our patient. So the next thing that we are going to do is to know the tactile premises of our patient. So we need to use the metacarpal phalanges of our hands in order to know, or in order to feel the vibration of our chest wall more accurately. So now we are going to, as we touch our patient, they are going to say 99 in order to know, or in order to feel the vibration. So the patient will now cross their hands, then will lean forward. So we are now going to do the palpation. Say 99, sir, as I palpate you, sir.
Yes, sir. 99. 99. 99. 99. 99.
So in that process, you are going to know if where are the parts that there are increase, decrease, or absence of fremitus. So in this case, the patient's response is normal, so it is good. So the next thing that we are going to do is the respiratory expansion. So the thing that we are going to do is we need to know and identify if the sides of our patients will work symmetrically with each other. So we need to palpate, or we need to place our hands in each side to know if the movement of these parts right here is symmetrical to our sides right here. So we are going to do this. And we are going to observe if the movement of our hands will be symmetrical with each other. So sir, I want you to inhale and exhale for 3 times. So upon doing the respiratory expansion, we know that the sides of our patient works symmetrically with each other. So the next thing that we are going to do is to percuss our patient in a systematic order, in a systematic way. So the first thing that we are going to do is to identify the sides that we are going to percuss. So sir, will you lean forward for a bit, sir? So we are going to percuss the side of our patient. So here, 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 and here, as well as here, and here, and here. So we are now going to percuss with our dominant hand over our proximal hand. So So upon percussing our patient, it is evident that the sound or the vibration that it gives off is pretty normal, and it is understandable that it is that our the posterior thorax of our patient is okay or normal. So that ends our physical assessment of the posterior thorax. So thank you.